Not a matter of if, but when crisis will rock your world. I'm Roshini Rajkumar, crisis strategist, licensed attorney, and host of The Crisis Files. In each case file, we explore a crisis situation and bring you trailblazers looking for solutions. Jolly Nanda is a healthcare insider and tech industry catalyst whose own journey of stops and starts with doctors and diagnoses led her to launch an app called Acuvia. Jolly is here for the case file I call MisDiagnosed. She'll explain why Acuvia could be a game changer for patients and caregiving. A staggering 12 million misdiagnoses happen every year in the United States. Before we dive into the alarming stats, Jolly, your own backstory was really the inspiration for Acuvia.
Yeah, about 17 years ago, my son was born, and after which, I started having symptoms. And as you know, most women, when they complain of any symptoms after you have a child, it's always categorized as, this is postpartum or something related to hormones. Yeah, it's natural. Give it a while. But for me, it just went on. So, and it was, not okay. And
so you had to basically, how long did it take to figure out what was going on? So blackouts even when you're driving, all of these different physical issues.
Oh, it took about a good year to figure out what was going on, and it took me having to consolidate or basically look at all of my medical history and all of the test data and looking across and finding patterns, almost like self-diagnosing, right? And then going and asking for the tests that I needed to get the right diagnosis.
And if you weren't already a healthcare insider, you might not have even known how to be a self-advocate like that.
Absolutely. I mean, if you don't know that you needed to do that yourself, you would just rely on your physician and basically do exactly what they say, because that's what we've been kind of trained to do, is listen to your doctor.
So the stats are alarming, 12 million that we know of misdiagnoses every year. And of those, around 800,000 that get some sort of wrong treatment, whether it's bad surgery that causes death, the wrong treatment that causes further complications and injuries. Why are there so many misdiagnoses?
Well, because so if you look at what physicians have to deal with, right, they all have EMRs that have the patient data within their system.
EMR, so tell us what that is.
That's electronic medical records. That's what, how they store patient data. But as we are now, we go across multiple health systems. So all the data gets siloed. And even though some patient data may exchange from one health plan to another or a health system to another because, you're referred to specialists, the data, when it gets transferred, isn't necessarily usable. They are attachments within the other system's EMR. And so it's not necessarily easily accessible to the provider to look at. And so that's why data gets missed. And there's so much also non-medical data that really is required, to really understand the patient. And the only person that knows that data is you. So unless you're collaborating with your physician on your diagnosis, the doctor does not know what's going on with you. They're not mind readers.
Well, and even knowing the data, you may know how you feel, but you're not I'm not a doctor, and a lot of the people watching and listening today aren't doctors. So they might know how they feel, but they don't necessarily know what is wrong with them or how to interpret any test or any graph, or you get a blood test and it's showing this. What does that even mean?
Yes, that is true. And that's where, the technology advancements are so great. AI is now able to, you feed that stuff into AI. It will tell you, what the possibilities are. But you obviously have to train the AI so that, it is actually giving you non-biased, accurate results. It has to be trained to do that. So I wouldn't recommend people actually just blindly loading their data into any AI and just, asking for a diagnosis. I
Right.
mean, physicians are trained to diagnose, but we can help them.
So let's get into that. So Acuvia, this is your app, and you created this. What stage is it at? Can we get at it right now? But I guess first and foremost, what does it do?
Yes. So good question. So what Acuvia does is it puts, the patient basically in control of requesting their data, and it's all done via consent. So all you have to do is give us consent to go grab data electronically or however your physician is able to send that data to us, and we go grab all of that data. And we make that data usable, so it's stored in a usable way. We then allow the consumer or the patient to augment it with all of your own, say, family history. So you can go back for as far as you can remember, how did your grandparents die? What was their health? I mean, that is all relevant to your health. What is your current diet like? What do you like to eat? How much stress do you have? Have you had any major life events? All of that is so important that creates a whole picture about an individual. And then you can share that data with whoever you want, whether it is for care or anything else, right?
So who is your ultimate, first of all, where along the timeline, the continuum of going to market is Acuvia?
We've already signed a first paying customer, and we go live on July 1st with a care
July
manager.
1st, 2025. So
Yes.
by the time people are hearing this, you will be live.
We'll be live. We've done a pilot with consumers already. The way that we are rolling our platform out is, yes, there's a consumer app, but there's also a way to connect the other stakeholders like caregivers and providers and employers as well.
So is the customer the consumer, the patient, or is it a healthcare system? Who are the customers? How do we even get access to using Acuvia?
Yes, so it can be rolled out via a health system or an employer group or a plan even. So what I call it is it's for all risk-bearing entities because everyone benefits from this, right? So for a health system, improving your safety and quality numbers is really important. And if you roll this out to your patients, then obviously you will help with misdiagnosis. For health plans, if you roll this out, it impacts, it lowers cost.
So it really impacts the bottom line. So often on the Crisis Files, as in our quest to find solutions and talk with trailblazers like you, we are also talking with you when you're not out there fully in the marketplace by any means, but hopefully people will watch this episode, listen to this episode, share this episode, and more health systems will find out about you, more healthcare providers will find out about you because, in the United States alone, we're about 350 million people. Yes. And then if you think of the world of 8 billion people, we are not alone in misdiagnoses when it comes to healthcare in the United States. So first of all, I just wish you and your team so much luck in getting this out there. And we are honored to be a minor part in your journey of amplifying and getting the information out. Let's talk about the data siloing and really help people understand why that's a problem. And even if Acuvia isn't out there in their healthcare state or city or system, how can they, as a patient, be more proactive to get the data into one place and to get their providers to read it accurately?
Yeah. So I'll basically say this, our parents' generation, right? We weren't mobile as much as we are now. So in healthcare, your doctor basically knew your parents, and they were able to really treat the whole person. That's not where we are today, and more we have retail health. You can go to any Minute Clinic, right? And there's so many of them. You can go to any urgent care, but data doesn't flow easily between, system to system. And it is getting better. However, it is not readily available when a diagnosis is happening. So the risk of that is, of course, you're not getting the right diagnosis, but there's also risk of drug interaction. You could be prescribed something that is going to interact with something you're already
and
taking.
Backfire.
Exactly, and it could be a supplement that you're taking as well, or anything that you have primarily in your diet. So that's where the data fragmentation comes from. Is nowadays there's all this direct to consumer testing, right? I'll throw names out there, but my Quest, so that's from Quest Diagnostics. You can basically now, as a patient, go and get your own testing done, and for significant discount. In fact, you can do that with Function Health, which is a subscription-based platform that basically does the same thing. You subscribe to it, and yearly you get a set of tests. But then the data is only sent to the consumer. How many of us have done the gut check? Right? Same thing. You send your the at-home kit comes in, you do the test, and the data comes to you. But your provider doesn't have access to it. But that's how these silos get created.
Exactly. So sometimes we are part of the problem.
Yes, but I wouldn't say we're part of the problem, because we're trying to solve a problem for ourselves.
Right, our own patient problem.
Yes.
Because the system is kind of working against us and the providers.
Exactly.
So I'm thinking about, and it's not an exact analogy by any means, but I'm thinking about following the events of 9/11 in the United States. It was very clear to law enforcement and emergency entities that their information was siloed. So police weren't talking to sheriffs, weren't talking to state troopers, weren't talking to blah, 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 FBI, CIA. So one of the positives that came out of 9/11, there are certainly some negatives, but one of the positives is more of the information, at least for law enforcement and public safety entities, are in a place where they can all talk with each other and all access it. It would be wonderful if that could happen for healthcare in the United States and in other nations.
Absolutely. And even in nations where, you have, the single health plan, you still have the fragmentation that exists. So as you mentioned earlier, it is not just a problem for the U.S., it is a global problem. And, if we empower the consumer to be able to gather their own data, be their own advocate, I think that the data shows that you can actually impact misdiagnosis by 40% if you're actually participating in your diagnosis by sharing the data, sharing your symptoms, and
not being bashful.
Exactly.
Some other interesting stats, 5% of overall misdiagnoses are because doctors do not have enough data. So that really gets at what you're talking about. And 35% of docs say they cannot get at the data. That seems really crazy to me. Why can't doctors get at the data?
Yeah, so I'll give you an example, which you know my health journey personally, but recently I went to my rheumatologist, and all of these test results had already been sent to her, and she's trying to figure out what's going on, and I'm like, well, we sent the data. I know my primary care sent everything. And she's like, yeah, but they came in as attachments. So it's not like I have to dig through it. So I don't think I did. Right.
So she's admitting she didn't dig through it or try to get at it.
Well, I mean, if you're not looking for it, right, and you don't notify her, hey, you need to dig through this. And how much time do they have?
They don't have a lot.
Yeah, because they're incented to see patients as much time as they can spend with the patient.
Right.
So
the average time a doc spends with the patient talking to them, and you taught me this, 15 to 17 minutes. And yes, you taught me that, but when I think back to my own doctor's visits, there's sometimes that or shorter periods of time.
Exactly. And if during that time they're digging for information, that's taking away, again, time from actually focusing on
So
it.
how much better it would be if they could come to your appointment already having looked at data, if it came in from other sources that didn't have crazy attachments that were unreadable or findable, and they had some preparation for that short 15-minute visit.
Well, for me, what ended up happening is I just pulled up my app and I said, boom, here, let me show you, right? And she went through it and she actually wrote it down. And then she was like, okay, this is great. Now I can, point you to, XYZ that's going to make you feel better. So
you were absolutely such a self-advocate.
Oh, yeah.
Okay. So as the world waits for Acuvia to be more widespread, what are a couple tips for crisis filers that you can give us today, Jolly?
I think, if you're having symptoms, keep track of them. If you start new medication, keep track of your symptoms and always make a list of all of the supplements you're taking, all of the, prescribed medication that you're taking as well. And because sometimes they all interact with each other. And when you're going to the physician's office, bring all of that data with you, whether it's in a paper file or whether, you want to use Acuvia, reach out to us and go to our website and we'll, I think we're going to be adding a link so you can add your, contact information. We'll put you on a wait list and
nice.
When we roll it out.
Yeah, breaking news right here. I love it. Well, Jolly, thank you so much, first of all, for being on this mission to empower patients and the entire healthcare system. I mean, this is game-changing, and we're so excited that you're talking with us on the Crisis Files and you're bringing it to our family and our community.
Well, thank you for having me. It is a mission from our heart, and my co-founders and I are very grateful for having this opportunity to bring the word about Acuvia to the public. So thank you.
Right. And I mean, as someone who's not at all a tech person, the fact that you're making tech accessible in this area that we all need so much. It is so needed. Learn more about Acuvia at altheia.com. I'll spell that for you, ALTHEIA.com. Today's case file is powered by Comcast. The Xfinity network is Comcast's next-generation broadband network. It delivers better reliability, increased capacity, low latency, and multi-gig speeds, all to power the rapid rise in internet consumption today and in the future. Find out more about the Comcast connection at corporate.comcast.com. Follow us on YouTube and Instagram at The Crisis Files. Rate, review, and subscribe to The Crisis Files on your platform of choice. Visit thecrisisfiles.com for all 3 seasons of the show. I'm Roshini Rajkumar. Join me next time on The Crisis Files.